And wow. कैमरा खाली बोला है
A very good morning and warm welcome to all the distinguished guests, esteemed colleagues, and valued partners gathered here for the formal signing and exchange of lease deed and MoA program between IIHMR Delhi and AMTZ Vizag. On the auspicious occasion, on the auspicious Shashti Tithi of Jesh month of Vikram Samvat 2083, it is my proud privilege to welcome Dr. Jitendra Sharma, Managing Director and Founder CEO of AMTZ Vizag, Dr. Arjun, Chief Medical Officer, Dr. S.D. Gupta, President Management Board, IIHMR, Dr. Sutapa B. Niyogi, Director of IIHMR Delhi, Shri Neeraj Srivastava ji, Vice President, IIHMR, respected deans, faculty colleagues, alumni, industry partners, students, and all the guests who have joined us in this momentous occasion at the IIHMR Delhi campus. Even in this scorching summer of May, the heat outside is surpassed by the warmth of the collaboration we share today. We are going to forge an alliance that will be marked as a true crossover milestone, bridging the powerful world of academia and industry. Let this day be remembered not just for the signatures on papers, but for the promises we make to each other and to the nation to work together towards a healthier, stronger, and more resilient India. Thank you once again. Let us begin this event by invoking the blessings of Goddess Saraswati and seek her guidance through lamp lighting. I invite all the dignitaries to please come forward and light the lamp. Thank you so much, sir.
स्माइल नहीं बोलती हो सर।
So one plus of thirty.
Thank you. Like to request everybody to stay back so that we can felicitate Dr. Jitendra and Arjun. SD sir, can you please do the honor?
Thank you.
AMTZ team, AMTZ team.
Thanks.
Yeah, and this hat, this next man. So health management for 2 months.
बिल्डिंग के ऊपर एक लोग में दो।
आपने ग्लोब बनाई था। बहुत लोगों को हमारे साथियों को भी नहीं मालूम होगा कि 2 डंडे क्या है। One is management, the other is health. And this is for people. Thank you, sir.
Thank you. Thank you.
Thank you. Moving forward, now I would like to request the Director of IIHMR, Dr. Shrutika P. Yogi, for her welcome address and brief on IIHMR. Very good morning, all of you, and a very warm welcome to our esteemed guests from MoA, Dr. Jitendra Shah, Dr. Arjun, Dr. Rajpal, Dr. Radhika, people who have joined online, our students, our alumni, faculty, staff from IIHMR Delhi. A very warm welcome to all of you on this very auspicious occasion, which is going to mark the beginning of a new journey for both AMTZ as well as IIHMR. I'll take this occasion to briefly tell you about the activities that we do. As we all know that IIHMR has a very rich and long legacy of more than 40 years, and it has the distinction of being the first ever institution in this country which started an academic program in the sector of health and hospital management. About IIHMR Delhi in specific, we were established in the year 2008, so we have just crossed our adolescence period, which is 18 years. And in these 18 years, we have done quite a lot in terms of expansion of our academic programs. Since the time we got established in 2008, our academic programs, both in terms of number of programs and the number of seats, the intake that has grown manifold. We have also started our PhD program, FPM program, which is equivalent to PhD 4 years ago. We also have the distinction of being the first ever management institution to get the NAAC A accreditation. We also started with the online programs, AICT approved online programs in the year 2024. And the last one in this journey is our satellite center, which got established at AMTZ campus on 13th of December 2025. So IIHMR has carved out a niche for itself to cutting-edge academic curriculum through online programs as well as offline programs, and we believe that all our programs have got a great element of industrial academic collaboration. We are going to make some revisions in all this curriculum in order to ensure that there is enough skill-based, industry-based competency and skill-driven components in each of the programs, and for that we are banking on our collaboration with AMTZ to a large extent.
We have very good viable collaborations with different sectors across the country and special institutions which are working in the field of health, the field of hospital, and also in the field of digital health. All these collaborations have made our internship placements possible, and also these have opened up new doors for doing research which are very much industry focused. We also have extensive community engagement programs for all our students who are pursuing different courses, both for online and offline. We also believe that our students should be getting exposed to different states and cultures, and which is why we have started with the students immersion program. Last year, 20 of our students had visited Vizag and they were extremely happy after coming there. So they have participated in the World Health Innovation Forum. I think the feedback was extremely constructive and good. This is in line with what is written as part of the national education policy, and we want to see that all of the programs as an institution we are able to make a mark in the implementation of national education policy as well. We are also extremely proud that IIHMR Delhi has also involved and included students who are there in the defense sector. This has been there since the beginning, and till date we have trained almost 84, I think it should be 85 now, professionals who are working in the Ministry of Defense. We have got very important collaborations with different international universities, and which is again a kind of a strength of IIHMR Delhi. So these are some of the institutions with whom we have formal academic and research collaborations: Imperial College London, University of Edinburgh, Scotland, Mahidol University, Bangkok, University of Jaffna, Sri Lanka. We also work with WHO Timor-Leste, ICDDR in Bangladesh, with National Open University, Nepal, with some of the hospitals in the Middle East, with University of Pretoria, South Africa, Tehran Institute of Medical College, which is in Iran, Johns Hopkins School of Public Health, Manchester University, and also Huddersfield University. So these are some of the universities with whom we are really having active collaborations, and we also are in the process of starting our student and exchange program. We have already started with 2, but with the rest is yet to happen. So all these collaborations have shaped our both research and academic portfolio tremendously in a positive manner, and we hope to get nominations from these universities even for our upcoming courses as well. We have formal student and faculty exchange program with Mahatma Gandhi University of Medical Sciences in Jaipur and also with Dr. B.R. Ambedkar University in Delhi. So the requirement of student and faculty exchange programs are that there should be at least one full module taught by a faculty and likewise the same year. So that has to be fulfilled in order to say that we are having a formal faculty and student exchange programs. We work in very strong partnership with the government. With almost all the ministries, we are having some or the other kind of licensing for conducting research or for supporting them for different activities according to their needs. Last year, we were also declared as an ICMR Collaborating Center of Excellence, and this honor has been given to 40 institutions across the country, and IIHMR Delhi is one such institution in the list. Also, we had inaugurated the IIHMR Delhi Satellite Center at AMTZ last year, and this has marked the beginning of our new journey for both institutions. And I would say that this was a kind of a groom hunting, a bride hunting kind of an endeavor. But now that we are entering into a new kind of a relationship, so MoA signing is going to be a kind of engagement, formal engagement with both the organizations. And I'm very hopeful that it will lead to successful marriage, followed by, and we both will produce a number of successful. Once again, a warm welcome to all. Thank you so much. And God willing, we are going to have a lot of many next generation leaders. Now I'd like to invite Dr. S.D. Pushpa, President IIHMR Society, for his address and words of wisdom. Is there a mic there? No.
opportunity. Good morning and a very warm welcome to Dr. Jiten Kumar and his team and my faculty colleagues and staff members of IIHMR. AMTZ, what we saw is the love at first sight. And that experience we repeated when we visited next. I just wanted to get the sanctity and develop understanding with the management. That what we are doing, you should know. And that's why I took with me Dr. Agarwal. That what is the future? Because this question was asked to me. Why you want to do this? It was very difficult for them to understand. I said the future of healthcare is medtech and research in medtech and health technology. So the next 10, 15 years in healthcare, the innovations will take place in technology. So we have to, those who get into it right now, they will be the one who will lead. And as Sutapa showed, produce more leaders in health technologies. If you look at the market for this, it's a big market, an evolving market. Is expected what we have today, maybe around $600 billion market. It should be doubled in next 7-8 years. So from business point of view, it's there. So can we write the cart to be with this development process? And this people generally think that because of the disease burden, technologies are dealing with the diseases or these chronic diseases especially. But I want to share with them and remove this misconception. Medical technology is more needed because of prevention and promotion of healthcare. If you can detect it early, you can prevent, you can change the course of the disease. So preventive work is much more important. So it is not only diagnostics and therapeutics and treatment efficiency and all that, but also preventive technologies. What is this wearable, this glucose monitor? I see this as a preventive one. So preventive medicine, preventive care is very important. So the technology has important role in both. I've been asking my colleagues, and in fact, I asked Dr. Arjun also that night when we were together, what we are going to do? What IIHMR should do? IIHMR should do what it does. It does human resource development in different areas, especially management of hospitals and healthcare and pharmaceuticals and information technology. So we'll continue with that. But now the domain will be additional, that is health technology. Managing technologies, innovations in technologies and managing innovations in technologies and taking it to the service level, to the point of care. This is what the organizations like IIHMR must do. So one is that, the second is the research part. What research we should do? We do product development, idea to product development, but hardly a proper community-based, user-based or patient-centered evaluation is done. User's perspective is not very much reflected. But big technologies, big inventions have been sidelined and dumped because people did not accept. So this is one important area for research for us. The characteristics of the people, the behavior of the people, and what are the reasons for acceptance or rejection. I think this must be there. And then technology characteristics and the system's ability for uptake. These are three important areas which are to be focused in our research work and give feedback to the technology industry, especially our technologies industry. And of course, we do a lot of health studies. So technology uptake, what determines uptake of technology? How does it work? I think these are some of the areas. So otherwise, the areas in medtech there's so many which have been described. If you open any AI tool and tell what the medtechs in the future, they will list out at least 20 areas in which medtech will work. But our domain is research. How does it work? Is it effective? Is it cost saving? Is it life saving? It is improving quality of life. So our work should be that, and of course, education. Very emphatically, I talked about health technology assessment, and it should be a separate vertical for MBA in health technology assessment or medical technology, whatever name you want. So we are trying to firm up our ideas. We are very much concerned what we will be doing that will impact the lives of people. That's very important. And we also want that you should feel we are useful to you. We are not one more company or institution that has come to the campus, but we want to be useful. We want to develop synergy with you and see the impact is much, much more through our research, through our capacity building, and through our education programs over there. We very eagerly look forward to work with you. We were very impressed when we went around and Dr. Jiten was very kind enough to spare time to be with us for more than 3 hours to take us around. And so thank you for your hospitality on behalf of the management board and myself that you took care of us so well. So welcome once again. We have a future, and let us see the future and act on it. What we saw 30 years back, we see the fruits of it, that we have been able to transform management of healthcare, transform research in healthcare. Can we really get into medtech area and do some path-breaking work so that more and more people are benefited with what we do together. Thank you so much.
Thank you so much, sir. Now I would like to request Dr. Jitendra Sharma for his address. But before doing that, let me introduce you who Dr. Jitendra Sharma is. Those who by chance missed his name, his credentials earlier. Dr. Jitendra Sharma is the Managing Director and Founder CEO of Andhra MedTech Zone AMTZ, which is world's largest medical device research and manufacturing park. He is founder executive director of Kalam Institute of Health Technology that serves as a medical technology policy institute to various departments and ministries of government of India. He is founder chairman of 2 medtech incubators, MediValley and BioValley, and chairman of Indian Biomedical Skill Council. He is also a member of Board of Trustees of India Brand Equity Foundation, a trust of Government of India, with a mandate to promote brand India globally. His work experience includes those at All India Institute of Medical Sciences, New Delhi, Sri Sathya Sai Institute of Higher Medical Sciences, World Bank, NITI Aayog, NHSRC, and World Health Organization, WHO. Dr. Sharma has led several policy initiatives such as PLI scheme, MedTech Park scheme, and he is a board member of several global scientific institutions. Dr. Sharma has been awarded the European Union India Award at EU Parliament Brussels, AMI Law Firm Great Match Award, and American College of Clinical Engineering Excellence Award for his distinguished work in medical technology sector. He has 3 PhDs and is author of the book Made in Lockdown. So, sir, we welcome you. Present your words and guiding lines for all of us.
Very generous.
Jai Hind, everyone. Good morning. Firstly, let me tell you a formula to do many degrees. Be such a difficult pain for your teachers that they feel relieved and pass you to the next grade. If you are a good student, they will like you. If you are a nasty student, they will like to get rid of you. But the only way to get rid of you is not to fail you, to pass you. They shift the problem to the next class. So my 3 PhD and 4 masters is an outcome of being a nasty student all through my life. Now, firstly, thank you so much, Dr. S.D. Gupta ji, Dr. Agarwal, who is not here today, but we should remember his leadership in us having here today. Of course, Dr. Sutupa, who is a wonderful, wonderful administrator, but also a great connector of people. And all the senior colleagues from IIHMR team that are here today, my own colleagues, Director of Gandhi Mandela Leadership School, Dr. Rajpal, Chief Medical Officer, Dr. Arjun, Chief CSR Officer, Dr. Radhika. IIHMR started in Jaipur, Registan mein shuru, on the sand. We are taking you to the beach, to Visakhapatnam. So it's a journey from sand to sea. But the sand is common. Sand is common. Whether it is in desert or on the ocean, sand is common. What is common between IIHMR and AMTZ? Research. What is research? Encouraging people to ask the question why. Why is the fundamental of research? Whether the apple falls towards the ground and Newton asks why, whether a cardiac function fails and a cardiophysiologist asks why, whether insulins are produced less, so an endocrinologist asks why, when there is a fracture, a radiologist asks why, when there is an epidemic, the epidemiologist asks why. The core of research is why. You as a IIHMR has been asking this question for the benefit of society. See, if you look at Indian society, we had 4 cadres in society. The Brahmins, the Kshatriyas, the Vaishyas and the Shudras, right? The people who churned knowledge were Brahmins. The people who used that knowledge for translational work, for protection, for security were Kshatriyas. People who translated that knowledge for transaction were Vaishyas. And people who served others with that knowledge were Shudras. But it was all because of knowledge. And these bunch of people were constantly asking the question, why? You all have been asking the question, why? Teaching others to ask why, finding answers to the why, helping society understand why something happens in health management. Let me tell you, from the time I was a student, one of the academic desires I had, which I never fulfilled, was to become student of IIHMR. That was my desire. I feel universe has given answer to my prayer by me standing here today and taking IIHMR to my place. मुझे वो नहीं मिला जो मुझे चाहिए था,
पूरा
लेकिन
IIHMR
IIHMR सबको दे पा रहा हूं आप लोगों के आशीर्वाद से, with blessings of all of you, and that was my desire. Now, as you have been told, today if you type on your Google AI or Chat GPT, you know, India was 98% import dependent in medical technology. And I will tell you one background of what Dr. S.D. Gupta ji rightly mentioned. It is all about medtech. मैं आपको दो बातें बताऊं. You imagine the entire healthcare as a circle, as a pie, and break it into 4 parts. Part 1 is land building. It will cost you, but that cost is not in your control. Part 2 is human resources, people and processes. Now, people will always expect more salary than previous year. So the cost of HR budget will never come down. You can reduce the number of people, but you cannot pay people less. Processes is what makes an organization strong, provided they are evidence-based or outcome of solid evidence and research. So people and processes is the second cost center, and it takes money to keep even those processes alive. Part 3 is pharmaceutical products and vaccines. Now, India has been a global leader in pharmaceutical products and vaccines for last 30 years. And part 4 is medical technology. Our weakest link, where India was import dependent to the extent of 98%. That is why we started AMTZ. Now reverse this circle of building land, people and processes, pharmaceuticals and vaccines, blood products, and medical technology. 4 parts of healthcare system, a hospital, roughly speaking. Now reverse this. A doctor is a doctor in a fantastic hospital, and the same doctor is a fantastic doctor on a railway station or under a tree, right? Under the tree also, he or she is the same doctor with the same skills. In your home also, the cardiologist can come and give you the same excellent opinion that he or she would give in a hospital. In your home, today you can order medicines, Pharmeasy, Tata 1mg. You can order medicine and medicines will come. From your home, you can consult doctor anywhere by telemedicine. So if the doctor is the same doctor in your home, medicine can come in your home, consultations can happen in your home, lab sample collection can happen in your home. Why do you go to hospital? Only for medical technology. Because dialysis machine cannot function in home. Operation theater light cannot be at home. CT scanner cannot be at home. Mammography cannot be at home. Endoscopy cannot be at home. So today, with the evolution of healthcare, you will realize the only reason people go to a hospital is actually medical technology. And that is why Dr. S.D. Gupta in his all wisdom, great people think deep, present it in a simple way. He said, futuristic health research is about medical technology. But if you analyze that simple statement of 4 words, you will realize that even today people go to hospital only because of medical technology. Everything else can come to your home. Everything else. And that medical technology is where India was import dependent, 98%. Then we built AMTZ in December 2018. COVID came in 2019, 2020. India was consuming 12 lakh, 1.2 million RT-PCR test kits every day. Every day, 12 lakh. 11 lakh every day was being supplied to the country by us every day. 1,000 oxygen concentrators, 500 ventilators every day we supplied to the country for 1.5 years. Today, thanks to that campus, the MRI that I used to buy in health ministry for 6 crore, I'm exporting at 2 crore 80 lakhs. Same MRI, 1.5 Tesla. Niobium titanium coil with helium crunching. Same MRI. And that is the magic medical technology can play. But every institution has an evolution. This is a 40-year legacy, what IIHMR has created. Some of you would know the example of, have you all heard an ice cream brand called Arun?
Yes.
Arun ice cream?
Yes.
I mean, it is summer, so we should remember ice cream. Even have one sometime during the day. Arun ice cream was started by a person called Chandra Mogan in Chennai. In 1986, Arun ice cream's annual turnover was 25 lakhs per annum. 25 lakh rupees annual turnover in 1986. 2016, in 30 years, 96, 2006, 2016, 25 lakh rupees was the business it was doing per hour. Annual turnover became per hour, not even per month, per week, per day, per hour turnover. Institutions grow exponentially beyond the adolescent age, beyond the 18 years age that Dr. Sutupaji very nicely mentioned. I think the time for exponential growth for IIHMR has started. Exponential growth, no more linear growth. Because even if you don't want now, it will grow. Because you have legends. Dr. Puneet, Dr. Kokar, all of you, you have leaders. Then you have next generation leaders. You have students. You have people coming for campus selection. You have demand working as an engine for you. So push has now become pull. And that's what IIHMR has achieved. Now, what we are trying to do at AMTZ and Kalam Institute is try to position India as a medical technology leader for the world. That is our single mandate. आपको जान के बहुत हैरानी होगी कि मैं आज आपके इंस्टीट्यूट का विजन मिशन वगैरह बोर्ड पे पढ़ रहा था. You will be surprised to know that our organization does not have a vision, mission, nothing. There is one mandate which is to make India a global leader in medical technology. And the way we achieve that mandate is one simple task. आपको जान के बहुत हैरानी होगी. Because vision, mission, हमें when we go to mother dairy to pick up curd or milk, we don't remember. When we go to drop a child to school, we don't remember. But आपको जान के हैरानी होगी कि हमारे इंस्टीट्यूट का विजन, मिशन, ऑब्जेक्टिव्स very simple. We don't say no. हमारे पूरे ऑर्गेनाइजेशन में we don't use the word no. It's a very difficult thing to have. Because when you don't say no, the answer is yes, You need to figure out a way to do it. And that figuring out the way to get the job done is innovation. If the agenda is yes, no, you cannot say no. Find a way which is legal, ethical, transparent, professional, evidence-based to do it. That path is called innovation. That could be inventing a OT light or an endoscope, creating a new system for management review, creating methods to support Divyanjans. It could be anything. What we are trying to do by this fantastic association, by letting sand come to sea, is to see, can the legacy, knowledge, leadership of IIHMR in health management and the expertise of AMTZ in medical technology create a superpower for India? We are no more talking of individuals. We are no more talking of admissions, both a byproduct hai. If there is one goal that we want to today have in partnership with IIHMR is to create, because we can create a machine. We are factory people. We have 183 factories. We will make products. You will make people who will ensure those products are used carefully, ethically, cost effectively, in a manner that suits and is compliant with regulations and technology with suitable training. If IIHMR and AMTZ joins together, this will be a historic, this is, not will be, it is a historic partnership that brings health management and technology development together. It will be an MIT and Johns Hopkins or Harvard School of Public Health coming together. Because one can create a product, another can create a people. And product and people together is what leads to transformation. One of them is of no use. Doctor without a stethoscope, a radiologist without an ultrasonography machine is of no use. And a sonography machine without a sonologist is of no use. Even if we talk 20 times about AI, it is useless without humans. It is useless without the user, as Dr. Gupta rightly mentioned. And therefore, with IIHMR, we want to do projects of 21st century. If you look all around, even cities, Paris, Rome, New York, Washington, DC, Tokyo, all of them are cities of 20th century legacy. But if you see the cities of Dubai, Singapore, Seoul in Korea, they are cities of 21st century. They have done something differently. They have tapped renewable energy. They have created better urban systems. They are cities of new century. I think together we can do projects of new century. New century projects means what? Today, in our organ generation center in AMTZ, we are making bio ears. For children born without ears, we take cells from the calf muscles of the patient. We fabricate using bio ink, a bio ear. We are making bio cornea. Bio retina work is in progress. The R&D is in progress. Bio pancreas, bio kidney, bio organs are going to change the way healthcare is delivered. Bio organs. Second, what telemedicine was 25 years ago, telesurgery is today. We have robotic surgery systems that can do telesurgery 2,000 kilometers away. Lag time on a 5G network, telecom network, is 120 milliseconds. 120 milliseconds is the lag time. A junior surgeon sits and does a bypass surgery using robotic system because the senior surgeon is sitting in Delhi. Both are having consoles. If patient goes out of control, the senior surgeon will take over. But the robotic system is able to do. Bioorgans, telesurgery, these are technologies of healthcare of 21st century. But if you add the other public health side of it, then the way India is progressing in sports medicine, you will be shocked to know that in entire country, there is no MBA program on sports health. Nothing. And what is parasports and sports? It is health, nutrition, assistive technology, rehabilitation, physiotherapy, facility management, finance management, content management. This is sports. We don't have a single program. So when Sheetal Devi, aap logon ne dekha hoga, when she shoots and wins an Olympic medal, no hospital administrator has thought who will create the next range of Sheetal Devis, because she is an outlier. She is an outlier. She is not part of the usual system of Divyanjans or paraplegics or physically challenged people. We don't have a BB or MBA program in parasports. We don't. Entire country does not. The second type of program that we get lot of requests. Yesterday, I was with a very senior group of defense policy makers. Is emergency operation theaters. Now they want to land operation theater in jungle, equip it with oxygen and perform a bullet injury. Look at what is happening in conflict-ridden areas, whether it is Middle East, whether it is Ukraine, Russia. Wars and international conflicts will demand healthcare to go to the area of conflict, because there is no time and logistical supply to bring the patient to the base hospital. Emergency operation theaters. The third is antimicrobial resistance. The entire management of healthcare due to antimicrobial resistance has not been thought, not been trained, not been researched. They are still discovering another antibiotic. Since all have failed, the research is on next generation antibiotic, not in AMR management, which will create its own problems. The fourth, as Dr. Gupta rightly mentioned, is technology assessment. Whether a patient needs a single lead pacemaker, double lead pacemaker. Today, what is happening, if you just go to the best of the cardiac hospitals, they will give you a warranty of, we make pacemakers, so we know what it is. Hamare pacemaker ki factory hai. We know that the accelerated aging test of the battery of pacemaker gives it a life of 12 years. But a hospital will tell you 6 years. Why? Because after 6 years, when the patient goes, they will replace it with a new model, which is not required. And therefore, technology assessment needs to be part of hospital management and healthcare administration. The fifth is digital hospitals and AI doctors. Entire hospitals, today the hospitals, we have another subsidiary called Make in India Hospital Private Limited. We are setting up 100 hospitals across the country, which will use only made in India medical equipment. They are called Make in India hospitals, because we are able to put Make in India logo on a satellite, but not in front of a hospital. These hospitals, the mattress of the patient bed where the patient sleeps will tell the nursing station SpO2 temperature, BP, if there is a sepsis. So the management will change. And the only way to survive is to adopt and change with time. And that change is triggered by thought leaders like Dr. S.D. Gupta. They see how difficult it will be if we walk on traditional path. They foresee a future by their experience, wisdom, and intuition, and they encourage others to take that journey. Today, we are here because he is able to see something that we are not able to. He is able to see a change which is coming in 10 years, for which we should become prepared. And therefore, AMTZ IIHMR partnership that takes sand to sea, which is the base, which is the origin of sand, is for single mandate, can health management and administration led by IIHMR, medical technology development led by AMTZ, make India a global leader in health technology management. A global leader. Now, others will benefit from us in a selfless manner, not because of profit, because of our ability to share and care. And the only way to do that is to take up projects, programs, and develop the faculty for projects that are of 21st century. Not projects that are 100 years, 50 years behind, but projects that will be the future of healthcare, because that future is inevitable. It is coming, you like it or not. We have to adopt and groom ourselves, our students and faculty to be oriented towards that future. So thank you for having us in IIHMR family. Welcome to AMTZ family. Hopefully, in a very short span of time, we will have another IIHMR campus called IIHMR Vizag. We already have a satellite center, but I think if IIHMR Jaipur, IIHMR Delhi, IIHMR Bangalore, now IIHMR Vizag, the four pillars of four zones in India through IIHMR institutions will benefit for generations to come. Thank you once again, and Jai Hind.
Thank you, sir. So the flight which we have boarded from the sand, and we are going to land on the sea very soon. For that, we need to sign an MoU. So the formal signing and exchange of the lease deed of IIHMR Vizag is to be done now by Dr. Jitendra Sharma and Srinivas Srivastava and Dr. S.D. Gupta.
These dates तो उसमें ये होगा, तो ये लैंड रजिस्टर होगी है। MOU आप रखिए, MOU की जरूरत, MOU तो आपके पास है ना? ये लीज डीड आप किसे कर रहे हैं? आप कर रहे हैं? जी। वो ये IIHMR का प्रोग्राम। ओके। मैं लंबा होना स्टेज में बैठ के खड़े होके करने से आपको बेंड लाइक Yeah, well, gee. You have to sign this. Me and Dr. Sutapa can sign this one. Yeah. Last page. Sorry. This we don't for land. Yeah, right.
एक बार सब इतने आती है
हाँ नहीं 2 डॉक्यूमेंट है तो जान ही रहा प्लीज
बहुत बहुत मुबारक हो सर ये लड्डू भाई लो वो लाए इस हिसाब से
देखिए you are a trend setter.
इंस्ट्रक्शन ऑफ डायरेक्टर
बोले
ये मेरे खाने के बाद डायरेक्टर ने लिखा साढ़े 12 बजे हाँ
Okay, thank you. Thank you. Yeah, go out.
Thank you so much, sir, for the signing ceremony. Now can I request Dr. Arjun, Chief Medical Officer, AMTZ, to make his presentation on the collaborations of APs.
Good morning, everyone. First of all, it's a honor and privilege to be here amongst you. And it's also a quite surprised for me that I've been asked to give a presentation. So thank you for throwing this on me. But first of all, it's a good opportunity for both the organizations to take this endeavor together. So with the legacy that IIHMR team has built over 40 years, and with what AMTZ has achieved in last 8 years, when it comes to medical technology, as our MD and Chairman Shri Dr. Jitendra Sharma ji said, we do have strengths which comes from speed, which comes from the collaborations that we have. We have over 180 organizations with us. So this opens a new ground, a new floor for people who want to explore what are the opportunities which is with the emerging technologies, with the research that is actually emerging. There is very, I would say, the data that has been collected regarding the aspects of health, which is changing so quickly. Let's say, for example, when 6 years ago, when COVID started, AMTZ was the only organization which could actually cater for the entire country in terms of having access to the electronic systems to be put together in place, to be able to test the RT-PCR kits in place. And this collaboration that we are beginning to have, that's going to give us new opportunities. We don't know what's going to come tomorrow. And this is not knowing, but being prepared is what we have been doing. And with all your support, with all the expertise that you bring onto the table with regard to the health management research, and with the technological advancements that's happening at AMTC, it's about time, like how Dr. Sutapa actually beautifully mentioned, it's a marriage, and we are going to have a lot of young leaders emerging from this endeavor. This gives us, I have actually made a list before, like, I just thought this is something which we can actually together explore. First aspect of health, which most of us have in the country, we have been only looking at health means there is a doctor involved. But before the doctor comes, there are numerous layers to this. The soil is very important. The water, the quality index of water, the quality index of air, all of these things have still not merged into the health sector. And if the emerging health interventions, if the preventive health interventions as we speak, if we can bridge the need for having to rectify the groundwater, if we actually look around, the rivers of the city has become the drains of almost every single city. So that's definitely one domain where the health innovations can happen in the next generation. The next direction is regarding the nutritional health of the people. Of course, I did see there is a lot of collaboration which is happening across the nutritional health. However, I have a master's in nutritional health, and I can tell you this. Today, a lot of children do not reach their milestones simply because the child is not getting the essential micronutrients, and the gut does not have the essential bacteria. And the public is not aware of this. The small plot of soil which grows the food, the first batch of soil takes all the minerals, and then the next, the child doesn't have access to the minerals. And imagine, all of us got that basic nutrition in the early evolution stage of life, and today's children do not have access for that. Then comes the use of, if you actually open in your YouTube and see how are the vegetables and fruits which are being sold in market dipped in pesticides so that they don't spoil, and that's the kind of food the child is eating. So the gut bacteria of the child is massively deteriorated. And then we have the climate health interactions which have still not been explored. We do have the urban health designs. Now, smaller place, lot of population is being packed, and we do not have the designs to match the essential healthcare in the urban systems. Another missing gap. Home care systems. AMTZ has been working on this for a while right now, and home care designs have still not been matured as it can across the country. The longevity sciences. So currently we have been only looking at the treatment, disease and treatment culture. We have not approached it from the longevity culture. Ayush or Ayurved, Ayu is literally translated as quality longevity. The Ayu is just not age. Ayu is quality longevity, and the data that has been held in the Indian diaspora for many years has still not been explored, and it has not reached the public in the way it can. We are just beginning to emerge towards the decentralized diagnostics, and still this is another domain where AMTZ has been working, and with the collaboration that we have, I think we can take it to the next level. Another aspect is behavioral sciences. Behavioral sciences is most of the reaction-based behaviors always have a short-term impact, and the successful response-based behaviors are actually not taught anymore in the schooling system. The child reacts, and we just have the short cycle behavioral sciences. Another place that as institute we can explore. We do have medtech, lot of medtech innovations which are happening, medtech entrepreneurship. That's another direction. Regenerative infrastructure, again, that's something which MTZ is already working. The policies regarding regenerative infrastructure has not been approached still appropriately. Shifting genetic epidemiology data. So as the environment changes, there are so much of shift that happens in the children that are being born. Children are being born with, this is something which, just observation, up till 1912, 1950, in the Indian, back then British was actually taking the government in its reins, and we have a disease called beriberi. So there was a huge spike in beriberi, and then after 1950, nothing changed. Beriberi vanished. So this is something which clinicians are aware. How did this disease suddenly vanish? So the human gut actually started to produce the essential amount of vitamin B1 in its gut. So there's a gut particle shift which has been responsible for some of these translations which is happening. And none of these things have still reached the mainstream. Currently, we are still talking in terms of diabetes, India as diabetes capital. No, India is actually not a diabetes capital. India is a drought-prone land. There's a difference between diabetes capital and the drought-prone. Every single plot of land in India, once in 3 to 6 years, will have either excess rains or excess sun. So the genetic population of the Indian community does not need the same amount of carbohydrates that today we are having access to. Last 60 years, 3 carbohydrate meal never happened in the genetic history of this Indian soil. And there are gaps that as a research organization that we can put together, as a country that we can actually start stitching together. And this gives a new ground. This is a new playground. This is something where data-backed policy is going to emerge. And for that, I think this collaboration will be a great initiative. And with all your support and with your presence and with the students and the community that you have already built, I'm sure both organizations can level up to the heights that we can today foresee and beyond. Thank you, Ananda.
Thank you so much, Dr. Raju. Now, can I request our Dean Academics, Dr. Puneet Yadav, to make his presentation on the activities planned at AMTZ by IIHMR.
Dr. Jitendra Sharma, Managing Director and Founder CEO of AMTZ. Dr. Sudapa B. Yogi, Director IIHMR, esteemed guests, faculty colleagues, and all members of IIHMR as well as from outside. I heartily welcome you firstly to this kind of a event, and it's been a privilege to have Dr. Jitendra coming here and signing the MoA. Last year I had been to AMTZ, and honestly, with my background in the Armed Forces Medical Services, I felt a tinge of excitement, to be very honest. And I take you back to my journey, which was about 15 years back, where we, as a part of the director of operations, we were actually struggling to find an Indian system for a field surgical unit. And that was the story. And we struggled for 6 years. It's been 15 years hence. Now it is coming to fructification. That is what India requires. A make in India, made by Indians out here for our problems and not being dependent on the world. The same problems we had with the blood transportation systems, where we did not have active blood storage boxes to be carried to the battlefield or to the various operations to actually give blood to the to our patients out. So that's a struggle, and that's where I felt a tinge of excitement in me. And that's where we want to build and we want to partner. And I'm eagerly, and I think I would acknowledge that I'm honored to be a participant in this journey that as we move forward. So with this back end and with this, we got home to actually brainstorming and thinking about the activities that we are going to perform at AMTZ. And I'll confine myself initially to the academic activities that we need to perform and our journey on. So the first thing that we looked at, there has been a shift from a theoretical based learning to a skill based learning approach, where people will actually go and perform the tasks. I was speaking with Dr. Yashpal Bhatia the other day, and he says that any student who passes out of IIHMR should be ready to work in the hospitals or any other sector right from day one. So that's where we are looking at skilling our students, not only our students, but also the community health workers, the pharmaceutical industry, the medical tech industry, and others. Building capacity for our workforce is an important element as far as vision and mission of IIHMR is concerned, and that's where we actually stand. Academic industry integration is a very, very important aspect. The national education policy has defined it and formalized it. And today, as we speak, AICTE and the UGC is coming up in a very big way to integrate these collaborations out here, to have participants, internships, dissertation, which are industry focused and industry based, to incorporate industry expert in the teaching curriculum. That's one element that we look at. Exposing our students to the medtech sector, and I'm very glad that we have started this program currently, which is already on, and we hope to make great strides as we move in the future. Supporting the Make in India initiative by Kalam Institute of Health Technology in the field of research, in the field of health technology assessment, and all other such domains. So that's where we stand as far as IIHMR AMTZ collaboration is concerned. But as we say in India, we plan things, but when it comes out to implementation, we tend to be fall back on that. This is a story which is we hear in India, but we do not hear in IIHMR, because as IIHMR Delhi will step forward and look at that. So we have to have an operational roadmap for that. When we derive an operational roadmap and when we were brainstorming, we were looking at how do we actually build it on. So the first thing, as it's a hierarchical stepwise approach that we are looking at. The first aspect is the webinars that is there. Then we move on to short courses, executive programs, online programs, PGDM and MBA programs, and thereafter the FPM program. At the start, what we have looked at is starting a webinar series, an initiative by Dr. Sudhapa, which has already been launched. And the issue is to bring in the medical device manufacturers, the regulators, the research in medical device, medical care experts together on one platform to discuss various issues. And already this mapping which has been done we have already picked up 4 to 5 topics which will be held every month. So that's the first collaboration we are looking at. We will have a faculty who coordinate all these activities so that it goes in a very, very seamless manner. So Dr. Shikha will be coordinating this whole issue. And our first launch is on 15th May. We are all welcome to join this and make it as a great success. The second part, which I would like to look at, is the executive programs. Now, the executive programs, the first program that has been suggested is the Executive Certificate Program in Health Technology Assessment. That has already been launched. The coordinator will be Dr. Sumesh, and we hope to start it in the month of July over the period of and have the presentation with aligning with the World Health Innovation Forum, which is being the month of December. So that's the first program that we are starting. We also looked at other aspects like digital health innovation, which is under formulation, or health and medtech innovation, as I would call it, which is under formulation and advanced discussion with the AMTZ. What we propose is we formalize the syllabus in the month of May, and we subsequently go in for a launch somewhere in the month of August or September. That's the time frame at which I'm looking at. So that's the second executive program that we are looking at. We may have future executive programs, which may be much more involved as far as the medtech industry is concerned. For the short healthcare management courses, we have the digital health enterprise planning, which will be conducted at AMTZ along with association with the IIHMR Delhi. We have UNICEF as the partners, which is the 1-week program, which will be likely to be conducted this year itself at AMTZ. We have looked at the topics which we have shared with AMTZ in the fields of operations management, in the healthcare supply chain management, human resource management, financial management, marketing management, and this is tailored towards the medtech industry. So when I'm talking of marketing management, it is application of, let's say, qualitative research tools for medtech or any kind of thing. So that's the application part that we are looking at, and it will be short courses. We are divided into levels: level 1, level 2, level 3. Level 1 will be essentially for just the introductory part. Level 2 will be a higher level, higher details, and level 3 will be advanced details. So that's the levels that we are actually looking at. This is again, we have drawn up a list. We'll be sharing this and consulting each other to take these short courses forward. At the present, digital health enterprise planning is already on. Thereafter, there are AICT PG certificate online programs, and we are running a one program in healthcare supply chain, which is AICT recognized PG certificate program, which has got the first semester as fundamentals to healthcare management, and then thereafter, subsequently in the second semester, a person can choose specialization in medtech supply chain management, medical device supply chain management. So already a couple of students have expressed their interest in taking medical device supply chain management, where we will request the AMTZ also to share the faculty as a visiting faculty for holding our courses. Health finance management, we have the specialization as HTA along with the hospital management. The PGDM and MBA programs. Now, the first program that we are already running is our course, which is in the PGDM with specialization. And this year, we have started specialization in pharmaceutical and medical device management. And what we will be doing is we'll be offering HTA as a specialization as a part of this program here. So that's the importance of the MoA today, because it facilitates us to reach out to the AICT and look at the student exchange program. We propose to have it from July 26th itself. The health technology MBA and health technology assessment, with this MoA, we'll be going to the AICT for having their health technology assessment as a training program with AMTZ. So which means that the students will go there and will have to spend time at AMTZ doing live projects at AMTZ itself, including the dissertation there, so that they come out well versed in not only in the theoretical aspect, but also in the practical and the application. That's another point. The thing is, now we have what is a fellow program in management, where to take our collaboration forward, we have offered 2 free ships, one in the field of health technology assessment, and the other one for medical device management or innovation or healthcare supply chain management, where we have requested the AMTZ to give us nomination of any 2 candidates, where we will be providing free ships to these candidates for taking these fellow program. What it actually, how we both stand to benefit is that we'll be able to get some very good research topics out of if we start having a research program right from the beginning itself. So that's the thought process which we have. And the coordinator is Dr. Anandi in this case. What we are looking at is research in health technology assessment, any innovation research that had been talked of by Dr. S.D. Gupta and Dr. Jiten Sharma out here. Any innovative, any topic on operations management for the medtech device industry, network designing, forecasting. The world is absolutely open in the field of healthcare management. So that's the framework. And as an activity calendar, we start our activities in the month of July. We slowly build it up. We have the DHEP coming up. We have the executive of courses of HTA. And along with the digital and health tech, medtech innovation, the supply chain online course and medical device specialization, the medical device management per se as a part of the MBA PGDM, and the HTA course which will be launching, and the FPM we propose to take. So that's a roadmap which we are there, and as we leap forward, as we go forward, I just had a quote from a poem: "The woods are dark and deep, but we have promises to keep, and miles to go before we sleep, and miles to go before we sleep." Thanks.
Thank you so much, sir. The program comes to an end. In the end, I would like to thank the entire team of MTC, led by Dr. Jiten Sharma, supported by Dr. Arjun, the entire team of IIHMR Delhi, with the leadership of our director, Dr. Sukupa, for their support in organizing this program. I also like to thank Dr. S.D. Gupta for raising this occasion and being our guiding force. Now I'd like to request everybody to please rise for national anthem. Now we can proceed for the heighting, but prior to that, we can assemble in the foyer for a photography.